For reducing the risk of transmission of COVID-19 during events or gatherings, the NCDC advises several things. Observing the physical distance, about 2 meters, hand washing, sanitizers where hand washing isn't possible, the distance between seats as well. It says avoid shaking hands, also avoid hugging. But how many people are observing this today in Nigeria and why? Well, joining us to talk more about this is Dr. Shalom Oni, a public health practitioner. We'd like to thank you for joining us today.
Thank you, Millicent. Nice to be here.
Okay, so first tell us, I mean, people are aware of the current national policy,
That's
the
right.
safety measures and the guidelines under the pandemic. But what do you think is happening? Do you think they're observing it? Are you satisfied with what you've noticed?
Well, the awareness is there because there's this recent study that shows that access to information and awareness about COVID-19 and preventive measures is around 62%. So that's fair if you talk about awareness, though I believe we can do better. However, going by what is happening around us, there are two things that happens, which I've observed. At the tail end of every wave, people tend to relax. Then during festive periods. So these 2 seasons are periods where I've discovered that, well, the tendency for people to relax MPIs, the non-pharmacological interventions are very high. So currently now, I think we are at the tail end of a 3rd wave. So a lot of people are relaxed. We are not hearing so much alert in the air about a 3rd wave now. We are not talking about values coming down. So a lot of people are relaxed. You know, face masking is not there anymore. You know, you could hardly find the hand washing post. You know, in so many organizations. You know, that one's there. People are now gathering. You know, indoors. You know, not observing the capacity. So that's happening. And you know, we have to be very careful because by this time last year, Lagos, Nigeria as a whole, we went into a 2nd wave. So now that we are going towards another December period now, we have to be very careful. Going by the fact that in Benin and also in Kenya, I think Algeria, Tunisia to Egypt, you're already in the 4th wave. They're grabbing with 4th wave, about 7 African countries already. So, and these are countries that have, you know, inroads into Nigeria through Lagos. So we have to be very careful, you know.
But some people argue that we can't help it since we're learning to live with the pandemic, and based on the level of our vaccinations, it's to be expected that we will move into different waves.
Yes. It's possible, yeah, that's the reality, that we must learn to live with this virus. But then you can determine severity. You can determine, because every wave has its severity, every wave has its amplitude. But by observing MPIs, you can determine the amplitude of your wave. For example, going back to Nigeria now, the 1st wave, 2nd wave, 3rd wave, they've come in different amplitude, they've come in different weeks of duration. So you can determine that, you know, by keeping up to your MPIs. Don't forget, a gamma wave, a gamma variant, you know, coming in, is looking for who to spread it. So if your face masking is not top notch, your hand washing is not top notch, your physical distance is not there, everybody's gathering indoors, you know, exactly, and the unvaccinated population continue to increase, then we are in for a 4th wave. So, but when all these things are in place, you can actually reduce the impact of a 4th wave.
You mentioned Lagos, and the state government says it's launching a mass vaccination campaign targeting about 4 million residents before the end of the year.
Exactly.
Is that realistic?
Well, it's an ambitious goal, but it's not impossible, because if you look at it, Lagos, I think Lagos has 2.7 million people vaccinated now, 1st dose, and 2nd dose over 550,000 with the 2nd dose, with 1st and 2nd now. So if you're looking at about 4 million by December 25th, it's possible. But I'm just only careful. I'm looking at the strategy. You know, the strategy is to increase, you know, the private facilities getting involved in vaccination, and also to catch the airlines. I think the focus is catchment of the airlines, who will not go to private public facilities, but rather provide private. So that's the catchment. But for me, I still think more needs to be done than that, because if you're talking about uptake of vaccine, there are 2 main factors that determine uptake of vaccine. The first one is the fear of the impact, side effect of the vaccine, and the second is the effectiveness of the vaccine. So how much have we done as a country, as a state, you know, to be able to allay the fear of people as far as the of the side effect of the vaccine is concerned, and as far as the effectiveness of the vaccine is concerned? Because if you look at it very well, there are some individuals who had 2 doses of the vaccine and also had COVID-19. If I had individuals who passed on, you know, who had 2 doses of COVID-19, that one is there. So this information, you have to come around and see how you can communicate this risk, this effectively, to the audience so that they can understand what is going on. But because if you allow all other information source to feed your people, then you're not going to make it hard way. But when you come on top of the information circle and you feed the people with the right information, because they are getting information from the various sources. But when you come up with the right information, then you are in charge. But when you allow other news sources to control the narrative, then you are going to be low on uptake of vaccine.
I also read a new study today in Imperial College London talking about how the vaccinated are even prone to carrying the Delta variant, despite the fact that they've been fully vaccinated. But then, if we come back, looking at Lagos's ambition of 4 million, and we look at the rule with herd immunity, I mean, the governor says this is to prevent or reduce a possible fourth wave. What impact will that have?
Well, getting Lagosians to 4 million vaccinated can reduce the impact of a fourth wave. But like I said earlier, if you want to prevent the fourth wave is thriving on gamma variants, and it is looking for who to spread it. So what to do is to make sure that the preventive measures are in place to prevent, avoid spread. And that is going back to our MPIs. The travel restrictions are also there. For example, like Benin now and Kenya, we should start thinking of flights are coming in. These are the things that will actually determine, the flight of a fourth wave. Because it's a new variant. All the waves have been eradicted by different variants. The gamma, the alpha, the beta, the delta. So the gamma is just coming in. So it's looking for who to spread. So the restrictions, the MPIs, the face masking, the capacity for indoors and outdoors, and things like that are what will determine whether we go into fourth wave or not.
In a few seconds, your advice to subnationals, what they must do, the education about the MPIs.
Everything must start from every house, individual house. The father, the mothers must take responsibility. Going back to the community leaders must also take responsibility. The religious leaders must take responsibility. Now, organization leaders, CEOs, MDs of captains of industry, you must take responsibility. Pump in the right fund, put in the right structure and system that will ensure that those you are leading, that those are under you, are fall in line with the MPI. Let me say something here. It is better we focus our attention on making it difficult for those who are not masked to enter a public place than those who are not vaccinated. When you make it difficult for people who are not masked to enter public place, it is better than focusing on those who are not vaccinated. There is so much to discuss on that.
Indeed. We would like to thank you. Always appreciate your time on the program. Dr. Shalom Money is a public health physician. Thanks for joining us.